Friends, as you know, coronary heart disease, which results in heart attack, now is on the center stage in the whole world, and this disease is now slated that it will be very common amongst the young. And WHO report says that the highest incidence probably would be in India. I am very happy to share with you my thoughts on coronary heart disease, especially because now, after about practicing for about 5 decades in this subject, I have realized that coronary heart disease can be prevented. Not only it can be prevented, but if it does occur, it can be treated very successfully in a very simple way by changing the lifestyle and using the proper medications without resorting to expensive interventions like bypass surgery and angioplasty. I can say this with a lot of conviction because I have been in the game for 50 years as a consulting cardiologist, and first 20 years of my practice there was no angiography or angioplasty in India, even though the intervention started way back in 1963 in USA. But now I have been in constant touch with all the developments because I am fortunate that I work or I am in contact with the West as well as the East right from the first day of my practice. And now very much so because for last 20 years my son is a cardiologist at USA and now an interventional cardiologist at a world renowned clinic, Cleveland Clinic in USA. So regarding intervention, I have also got almost a first hand experience. My own brother, I took him to United States in 1986 for bypass surgery. And as I said to you, my son is an interventional cardiologist doing angiography and angioplasty every day. That way, having collected all this experience and watching the scene without the help of intervention in the first 20 years and all this now these 40 years with the intervention, and having had the experience of intervention for my own brother, I am not at all against intervention because my book, which became very popular, was actually launched by the famous bypass surgeon or the surgeon, the heart surgeon, Dr. Ramakant Panda, who operated upon our Prime Minister, and who is now today it happens to be today in the news, he has his services as a surgeon has been recognized in the Guinness Book. So I am not at all against intervention, but what I have realized, and that is being realized even in the United States, that now with proper understanding of the disease and better pharmaceutical agents available to control the disease or control the progression of the disease, and the lifestyle changes which we have understood can be done, the disease can be treated in large majority of cases without intervention and very successfully. And some of them do think now, some of the senior people, the cardiac surgeons as well as the people who are practicing interventional cardiology, they feel that probably the days are over for intervention, and who knows that gradually it may go into history. Similar example I can quote once and then I will talk to you what is important for the young people. but I don't know how many of you know, but 60 years ago my own uncle developed tuberculosis, and at that time TB had no treatment but only one treatment. The people used to rest in sanatoria and just wait whether it will go away or they would die. Our very beloved Prime Minister Nehru, his wife Kamala Nehru, died in Switzerland of tuberculosis. When my uncle fell ill 60 years ago in tuberculosis, at that time there was a surgeon in Bombay known as Dr. Billy Moria. He used to make one nerve at the top of the lung. He used to make it, make it dumb, so that the part of the lung used to collapse, and the bacteria which were in the normally in the top part of the lung, they used to get they used to get caught into the, or they became absolutely inactive because the lung collapsed and the people used to get well. So at that time they thought that if you get tuberculosis, you have to reach Billy Moria in the operation, then only the TB will be cured. And at that time it cost about 3,000 rupees to get that done 60 years ago. So then the research came and came and came, and now you know that TB can be treated very effectively with medicines. Similarly, the history with many diseases, and that is what I feel with coronary heart disease. Having given you this picture about coronary heart disease, now we know that coronary heart disease, the cause of coronary heart disease amongst the young now is the heredity. There is a factor, there is an enzyme which is lacking in the liver, which makes the harmful cholesterol, increase of harmful cholesterol in the blood, and harmful cholesterol is LDL, low density lipoprotein. There are two types of cholesterol, one is exogenous and other is endogenous. Exogenous cholesterol comes from what you eat, which is fatty substance and all that, and endogenous cholesterol is which is formed in the liver even if you do not take any excess fat, then also it can occur, and therefore some treatment is required to keep the LDL under control in the people who have got a strong family history. As we in our family there is strong family history. We 24 family members of the blood, the first cousins of both the sides, 21 got the heart attack by the time they came down to 60 years of age, and all of them, none of them were overweight, none of them had were smoking or having or used tobacco. Actually they were very healthy lifestyle, and even then they got the heart attack. So the great factor in all of them was heredity. Heredity can't be helped. Of course now they are studying if we can do something with that deficiency of the enzyme, but we have now a very safe statin group of drugs available which can be used without any serious side effect, which would keep that harmful cholesterol in check and prevent the progression of the disease. But lifestyle change are important because ultimately with all the factors, the most important factor which results in heart attack is stress, and dealing with the stress in all circumstances of life is difficult. We came across, or I came across when I was in my frequent visits to the United States in 1991, a program which was being conducted by an American cardiologist, Dr. Dean Ornish, and he had in his team 40 coronary heart disease patients who had triple vessel disease. The three arteries which supply blood to the heart were completely blocked, and they were all supposed to go for bypass surgery, but they did not go for bypass surgery and joined Dr. Dean on his program. He is a pioneer. He thought of it because people who underwent bypass surgery, they required the bypass surgery again, and it did not deal with the root cause. So these people, even though they were insured, there was no question of spending money, there was no financial consideration was not there. Even then they joined his program, and with the lifestyle changes and the program, when I met them after they had been in the program for more than 10 years, when I met them, they were all symptom free. I think it was 25th June 1991 that I walked with all of them on San Francisco beach for about 5 miles, and none of them got the chest pain. They were all taking the required treatment, and they were also doing a program which helped them to change the lifestyle. About that I am now going to talk to you. Now the program consisted of light stretching and relaxation exercises, and after that it followed by Savasana, which he called in English a very nice word for Savasana. Here we call Savasana a dead body pose, but he said it's a progressive deep relaxation resulting in complete relaxation, almost like a dead body posture. And then meditation. So this program of light stretching and relaxation exercises leading to progressive deep relaxation, that is Savasana, and meditation. And that helps this group of people to change the lifestyle and meet the challenges of life. We started this program on 2nd October 1991. That was a coincidence. That happened to be Mahatma Gandhi's birthday. And then everything is so much associated with Gandhi that all the books which I happened to write regarding the program and the coronary heart disease were published by Navjivan Publishing House, established by Gandhi. And my association with this institution right from the day I came to India, because of Morarji Bhai Desai, who was the chancellor of this Vidyapith and who took interest in my studies right from my school days. So with this introduction, I want to share with you why Savasana, practice of Savasana. These light stretching and relaxation exercises are done not for the exercises or any physical benefit, but only to be able to do Savasana in a more effective manner. Savasana became more effective by practicing those light stretching and relaxation exercises. Like I tell you, the first exercise is raising the hands over the head like this. When in the school during physical training class, we used to do that for the sake of physical benefit, and we used to teach students to do this, do that, and other exercises. In this program, when we raise the hands over the head, the difference is that supposing you got something wrong with the joint here and you can't raise the hand properly, you can raise even this much, or you can raise this much. Raising the hand, how much you raise, the physical exercise is not important, but when you raise the hand, you bring your awareness to the muscles which are being stretched, and when you relax the hand, you bring your awareness on the muscles which are being relaxed. So from the very first moment, you are in the present moment. Normally every individual of 16 hours of his waking time, we found out in one experiment, if only for 1.5 hours we are in the present moment. During only for 16, normally a normal person only is 1.5 hours in the present. Now, right now when you are listening to me, you might be thinking of so many things, and while I am talking I might be thinking of something else. So that's the best thing to do Therefore, we found out that we raise the hand, we instruct. This first exercise is enough to understand my whole program. And this just raise the hand. You can raise this much, you can raise this much. Don't raise too much so that it becomes uncomfortable. Raise only that much which is comfortable, and bring your awareness to the muscles which are being stretched at this time. Just keep your awareness there. If the noise is coming, do not worry about the noise. If people are talking, do not worry about that. If the thoughts come, gently tell them that, okay, for one moment, please let me have my awareness on the stretching of these muscles. And then relax, and then now have our awareness on the muscles which are being relaxed. Like that, one by one, light stretching and relaxation exercises we do in the standing position, which you can see in our video, which is now available on our website, completely free to download and see it. So I am not going to demonstrate that here. So that in the standing position, then we sit down and do the exercise in the sitting position, light stretching and relaxation exercises. Again, exercise is not important, relaxation is there important, but awareness on the whole process is important, and whatever you can do, you do it. So therefore, we do the stretching in relaxation in the sitting position, and then we lie down. After a moment, I am going to lie down and show you what we do. Again, that is available on the video on our website. However, I want to stress one point, that when we then, after doing this light stretching and relaxation exercises, when we lie down, then again we bring our awareness to the toes, and from toes up gradually we do the light exercise like stretching the toes like this, and then relaxing, and again keeping our awareness on what muscles which are being stretched, and then relax, then forgetting it, and then bringing it awareness on the leg. Raise it only as much as you can, feel the stretch, and then relax, and then feel the relaxation. Do it twice each exercise, and then forget that. Then do it on the right side, then forget it. Then raise your the back part like that, forget it, and then come to the hands and do that, and then forget again. Like that, we come to the neck, we do this. Having done right up to the head from the and then when you relax the whole body, you forget the body. Now the important thing is that why we did all this, that when we stretch and relax every part of the body and do it successfully, keeping our awareness on the stretching and relaxation, and then having relaxed the whole body, when the body is relaxed, most importantly, we never realize up till now that the mind automatically gets relaxed, because mind is not present above the shoulders in the head only. It is present in every cell of our body. So when we have done this all, and this was mentioned by our father of medicine, Hippocrates, 2500 years ago, that mind is present in every cell of the body. And therefore, when we did this very systematically and very nicely, very easy to understand, easy to perform, nothing complicated. The whole program is so simple, and because it is so simple, I keep on explaining the people, I don't know till what time, because all simple things have to be explained all the time, all the time. The complicated things come very easy to everyone. But when it is simple and more simple, it is more difficult to understand, in the sense that, or to grasp it. And especially for people who have lots of knowledge and people who have got lots of understanding about all the practices of yoga, all the practices of Vedanta, for them it is so difficult. But I find a normal rickshaw driver or a person who is not at all expert in any part, they actually easily understand what we are trying to teach them, and they relax. Otherwise, I get persons in my clinic who tell me, doctor, I practice yoga like mad, absolutely regularly. Even if I have to go to my flight at 6 in the morning, I get up early and do this exercise before I go. I don't miss a single day. I have been doing this, I have been dieting and all that, and still I got a heart attack. Why? He comes and tells me, the executive. And I tell him exactly, but because you are doing this, you got the heart attack, I said. Because what you are doing is, it's just a ritual. But actually you are just entrapped in the usual stress which every one of us. So I said, stop doing all this for a few days and then you will be all right. I had to tell one executive like that. So understand this, that this is extremely simple, and as if you give up all your previous knowledge about everything and just learn simply to be in the present moment when you stretch your muscles and keep your awareness on the muscles which are stretched and relaxed, and then forget it, and then come to the pose of Savasana, and in that, after relaxing the whole body, then forget the whole body and keep your awareness onto the nose where the breathing is occurring, where the breath is going in and coming out. What a wonderful thing it is that we, all of us, right from the time we come out from the womb till we die, we breathe, and still we don't have to care about it. You won't be able to listen to me if you are not breathing. I won't be able to talk unless I am breathing. But we become aware of the breath when we relax our body and mind. So when we relax the body and the mind, and the body and the mind, when we relax, our body and mind are our outer form, which are separate from all of us. We are all separate individuals, and we all the day we are concerned with the functions of our body and mind, and that is going on through our simple action of breathing. But we do not care about the breathing, and we don't have to, luckily. Otherwise, supposing I had to breathe for 1 hour before I talk to you, the life will be miserable. So that's why I tell you that when the whole program in nutshell is this, that you become aware with something, a part of you which keeps you alive and well, our body and mind, which are our same functions till we breathe last. And that part which keeps us alive, our soul force, our breathing is a soul force, our life force, and we are not at all aware of it. So when you completely relax your body and mind, and in Savasana, that means you have relaxed the whole body and mind, when you are almost in a dead body pose or in a completely relaxed state, keep your awareness on the nose and just see. Do not try to change your breathing. Again, all pranayams, the people who are expert at doing pranayam, again they do something here and there. Again, that is a body. But just going on, become completely aware of that breath without any fuss about it. That means you have forgotten the whole thing. Now you are one with your breath, and just watch the breath going in and coming out. And don't make any changes in the breath, and still the thoughts will come. Then you tolerate, you lasso, and you just like when you try to pacify the child, all right, so that you just say to the thoughts, all right, for a moment, please let me be aware of my breath without any undue force, and just keep your awareness on the breathing. As many times it wanders to the thoughts, bring it now gently to your nose. People tell me, I'm not able to do it. I said, when you know that you are not able to do it, that is, you are able to do it. You know that you are wandering, that means you are aware of your wandering. So that is enough. And then try to bring it to the nose as frequently as possible, and then become one with the breath as it goes in and comes out. As you see, when you are aware with your breath as it goes in without making any effort, your tummy rises, and when it goes in, the tummy falls. So that is an abdominal breathing. So we forget the abdominal breathing. If you do the abdominal breathing, your system becomes very quiet. And we have two systems, one is a sympathetic system, other is a parasympathetic system. Sympathetic system makes us active. If there is a fire here, we can just run. Parasympathetic system, it's is active when you are relaxed. So the balance of this thing, and when you become one with the breath, when you become one with the soul force, or the force which is common to all of us, and that experience for about 10 minutes, we found out that changes your behavior for 3 to 4 hours during the day. The first person who came, there are many people when we started the program mainly for coronary heart disease, so that they become relaxed and their angina improves and all that. That's how I took the program. I started the program in 2nd October 1991, because I had seen those people recovering from that. So when the group came to do this program for 30 minutes or 35 minutes in a group, and when they went home, we were doing it only twice in a week. When they came again, so many people told me, the spouses of the people who were participants, the spouse, he said, "Doctor, the angina is now little less, he is taking the treatment." I said, "Don't stop the treatment, take the treatment." But he said, "Angina is less, but also now he is less angry, less hostile, he is little bit more considerate." So he is changing the person as well. So I thought that this program is not only helping the symptoms of coronary heart disease, but also helping the whole individual. And therefore I termed the program Universal Healing Program, UHP. Now it has become extremely popular all over the world as UHP. That's how we termed it. So this is our program. Now that this simple program I would like to introduce to all young people, because this program takes only, if you really do only Savasana, having done exercises, it's better to do the whole exercise of 30 minutes. But if you do not have time, and the other thing we found out, that if the 3 people get together and do the 30 minutes exercise together, 3 people, more than 2, 3 is a group, 3 or 30 or 300 is a group. This was a very interesting study by Dean Group, that when 3 of them do it, the effect of this lasts for 72 hours. So now, as I have explained to you, that when you become one with the breath, we are made of body, mind, and the soul or soul force, which we do not see, which nobody has seen, but we can experience the soul force when we become one with our breath, which is common to all of us. I introduced my program in one school in Mumbai with 1,000 students, and they were all in the 9th and 10th class, and about 400 of them decided to do this program regularly of Savasana and meditation, the end part of the program. After the stretching and relaxation exercise, the Savasana and meditation takes about only 15 minutes. So I had made a special cassette for them to start with Savasana and meditation. And they did this program for 1 year. And then I was invited to talk to them. So when I reached the school and began talking to them, all the students were there. And I was so happy to see all of them there, and these teachers were sitting on the sides in the chair, and they were all sitting on the floor in front of me. I was talking to them, and suddenly I said that you have practiced this program for 1 year. Tell me, how have you felt after the program? And also tell me, what have you found out? What is common to all of us? We are all different individuals. I have to go somewhere else after this talk. You have to do something else. We are all busy doing our course every day. But what is common to all of us? So 3 students raised their fingers, raised their hands. So afterwards I asked one of them, I said, what is common to all of us? He said, our breath. I was so happy to learn from that student who, after having practiced the program, immediately said that our breath is common to all of us. I said the dog which is at the end of the hall, one dog was sleeping, I said he is breathing the same air, and the trees are also breathing the same. We become one with the whole universe when you become one with the breath, and that's why we become completely relaxed and we experience a harmony in our mind, in our feeling, and that starts all the healing process. One gets completely healed of any disease, because when you become one with the people, again Bruce Lipton, a great biologist, he has written a very great book, Belief, isn't it, that I forget the name of the book, but it's by Bruce Lipton, and he has all the time dealt with the cell's biology, but he says that during our feeling of harmony or feeling of oneness in our mind, feeling of oneness, all the cells of the body proceed towards life. Their cell divisions, the telomeres and everything also all become towards life. And when there is discord in our mind, this process of going towards the life gets little less, and actually he says they travel towards death, in the sense that their cells of multiplication becomes less. So we have found out in our program that people who practice regularly this program, even for 10 minutes twice a day, only Savasana, they have been benefited immensely. So now I come to the important part, that I have been giving, I was invited to talk about this program several times during my visits every year. During summer I go there, and I had I was fortunate that I had to talk to various groups. Once I talked to the university in Duke University, and in Los Angeles, and I was talking once. So various places I was talking about meditation and longevity, how it helps longevity and meditation. So there in one of them program, I was just luckily introduced to one person who happened to be a doctor, and he was teaching Mr. Clinton 1 minute meditation. So I was surprised. I said, he was asking me questions. I said, what is this 1 minute meditation? So and he was asking me questions about meditation. I said, but you teaching a 1 minute meditation, let me learn from you what is 1 minute meditation. So he showed me that. So I want to demonstrate to you what he meant by 1 minute, which was very effective to me. And I said that this should be practiced by anyone gets 1 minute. So after 90 minutes or 90 minutes of work, you can do it for 1 minute wherever you are. So 1 minute meditation, and then the Savasana, which was taught to Dr. D. Nordis by Swami Sachinanandji, who settled in Virginia, who was disciple of Dr. Sivanand Swami here. That he taught his Savasana, quick Savasana. People do not have time, so he said that just they do all the stretching and relaxation exercises, and then they get relaxed, and then they lie down and they become one. He said we can do quick Savasana within a short time. So that these two things I am going to tell you, and then we stop for the day. So the 1 minute meditation, he said that if you are sitting in the chair like this in the office, just sit like this and see that you are comfortable in your day. Just see that there is no stress anywhere, and so like that you do, and gently close the eyes. Closing eyes is not imperative, but gently closing is better, you are not disturbed. And then keeping all the awareness on the body, just stretch the body. Stretch it comfortably, don't stretch it that you don't like, but stretch it comfortably. And then experience the stretch in all the muscles of the body which are being stretched. If the thoughts come, tell the thoughts, okay, I like to keep my awareness on these muscles which are being stretched. Then relax and keep your awareness on the muscles which are being relaxed. Do it once again. Stretch, keep the awareness on the muscles which are being relaxed. Just experience the stretch in the fine stretch and relax, and experience the relaxation everywhere. Now forget the body and bring your awareness on the tip of the nose. And now don't change the breath, but just become one with the breath. Don't let any breath go in without your knowledge. Be a complete witness to your breath. The breath is going in and coming out. Be one with it. And to be able to be one with it, you can do one thing that Mr. Clinton used to say, when the breath goes in, mentally say I, mentally. And when the breath comes out, mentally say am. When the breath goes in, mentally I, when the breath comes out. Now like that, you watch about 7 to 8 breaths without making any haste. Just watch it. Goes in, the thoughts come, just bring your awareness onto the nose. And that gradually open the eyes. In India, I teach them that when the breath goes in, mentally say so, and when the breath comes out, mentally say hum. So when it goes in, hum when it comes out. So it's a very simple way of relaxing every 90 minutes. As I said before, we practice Savasana after doing light stretching and relaxation exercises in standing position and in sitting position. And then we lie down and go into Savasana. If we don't have time for anything, then we can do Savasana, a quick Savasana. Just we lie down like this. Just we keep all our awareness on the body, and just we keep lying like this in a relaxed manner, and then stretch our body like this. Now when we do this stretching, it should be comfortable stretching, and we keep all our awareness on the muscles which are being stretched, and then relax. And then now we keep our awareness on all the muscles which are relaxed. Very simple. Now I am aware with all the muscles which are relaxed. Again I stretch all the muscles which are, stretching the whole body, but comfortably. I am comfortable. I am experiencing the stretch and then relax. I experience the relaxation. Then forget the body and become one with the breath. Now I am one with the breath. Do not change the breath. Just become one with it. As it goes in, say mentally I or so, and when it comes out, say mentally am. I when it goes in, am when it comes out. Become one with the breath. Remain one with the breath for about, as you are comfortable, say for 5 minutes or 3 minutes. Thoughts are bound to come, but do not feel that how can I become one with the breath. Just gently lasso your awareness on the breath. Don't try to force anything, just gently bring your awareness onto the nose without making undue effort. Just do that. As many times the thoughts, our awareness wanders to the thoughts, that many times you gently bring it. Even that whole process of bringing it awareness to the nose also is a part of Savasana or meditation. So do not worry. If you know that the awareness is wandering, that your knowledge that it is wandering, your awareness it is wandering is enough to say that you are aware of the thing which you are doing, and that is also a part of practicing Savasana or meditation. So remain one with the breath for about 10 or 15 breaths and then gently come out of Savasana. If you have a back problem, then instead of bringing the whole body like this, you can do only this and not keep this. Experience the stretch and then relax. Experience the stretch and then relax. Do not raise the upper part of the body. And then again become one with the breath for as much time as is comfortable to you. Become one with the breath, as I explained to you before. And then gently come out of Savasana. He said, this is something wonderful. What they do now, we have got this all free to download from our website. And when you download it, you can download it on your cell phone so that you don't have to play anything. You just start your cell phone, it is now contains the quick Savasana or Savasana itself or a meditation. And they start this and they practice it. Several young people's examples I have got where they do it and they have been able to beat the daily stresses, at the same time they give up their habit of excessive use of alcohol or give up smoking altogether. Thank you very much. I have enjoyed talking.